morning. My name is Mary Turner. I'm president of Minnesota Nurses Association, and I brought a few friends today. Anyway, we are here today because the Health Omnibus bill is being heard in the House, and so I am going to bring up the heroine of the hour, Representative Sandra Feist, to kick it off. Thank you.
I would clarify that the heroes of the hour are behind me, are the nurses here in Minnesota who have been fighting for this bill since 2008, and this is the year we're going to get it done. Yeah. So we are on the cusp of passing this bill off the House floor, and it will now have gotten further than it has ever gotten in the legislative process. So this bill reflects the status quo of staffing at hospitals in Minnesota is unsustainable, and this bill represents a step forward from that. Many hospitals and nurses have shared stories with me of unsafe staffing in Minnesota hospitals. They've talked about long waits in ERs. They've talked about patient exams and surgery recuperation in hallways. They've talked about regular physical assaults of nurse and staff. And they've talked about readmission to the hospital immediately following discharge because of holes in care and holes in advising patients on how to care for themselves after they are discharged. The status quo is unsustainable. This bill is a comprehensive bill to empower nurses to address unsafe staffing. It's going to address factors that lead to workplace violence in hospitals. And it's going to make investments to train, recruit, and retain nurses at the bedside in Minnesota. There is no shortage of registered nurses in Minnesota. In fact, there are 122,000 registered nurses, which is more than has ever been the case in Minnesota, and 4,000 more registered nurses than last year. But 2,400 nurses left the bedside last year, and they left it overwhelmingly because of unsafe staffing here in Minnesota. So this bill is going to bring them back to the bedside. This is not a new bill. As I mentioned, it has been around for a very long time. It is addressing an issue that has gotten increasingly worse long before the pandemic. The pandemic just really highlighted the holes in staffing here in Minnesota. I have had many, many hours with hospitals, with chief nurse officers, with chief executive officers, with the Hospital Association about this bill. And over the course of this session, we have worked very hard to incorporate that input. And this bill is stronger for it. It is workable, and it is awesome, if I do say so myself. In addition, I think it is important to note that this bill is moving in tandem with a lot of other supports for hospitals, a lot of other workplace development investments in the healthcare sector, and it cannot be considered in isolation. It's really part of a large package to support hospitals, support healthcare workers, and to support nurses in Minnesota. So bottom line, this is a well thought out solution to unsafe staffing in Minnesota, and I had something brilliant to say. This is something that hospitals, nurses, and most importantly, patients in Minnesota have been waiting for a very long time. I am incredibly honored to be working with the Minnesota Nurses Association and all of you amazing nurses to make sure we pass this bill. Thank you.
All right. Thank you, Representative Feist. Like I said, you're our hero. Bring it at home. You know, the people of Minnesota need to know that the nurses have been working on this for over 15 years. For 15 years, we have been fighting for the right and the privilege to give compassionate care, and more importantly, to be able to advocate for you. So this is a message to the people. 15 years. And for 15 years, we've been coming up to the Capitol. And today, we are going to be, I'm confident we're going to be one step closer to having that legislation that will give us the opportunity to do what we have a right to do, and that is to advocate for our patients. And I want to give represented some really good news and the rest of the hospital association. We actually did a real updated number. 8,000 nurses have gotten their new license in Minnesota. We have 130,000 nurses in Minnesota. That was new updated information we got from the Board of Nursing. So folks, there is no nursing shortage. What there is a shortage of nurses who are willing to work in the working conditions that we have in our hospitals. And there is a difference. And here's the other thing, is you as the people of Minnesota, you are seeing it. You see it in our hospitals when you're afraid to leave your loved ones at the bedside because you know that the nurse might not get to you. So that's why we're here, folks. That's why we've always been here, and we will be here until it gets done. Thank you.
Hello, I'm Chris Rubish. I'm First Vice President for the Minnesota Nurses Association. For decades, nurses have been raising the alarm over patient care and staffing levels in our hospitals. We've shared our experiences, we've collected data, we have filed reports, we've given testimony in this building. And today, finally, our legislature is on the cusp of addressing hospital staffing. Minnesota has the opportunity to once again be a national leader in healthcare. And let's be crystal clear about why we are on the verge of making this history. It's because of all of these people behind me, the nurses. It's because each and every one of these nurses have talked about staffing to a friend, a family member, a community member. It's because they all showed up to talk with elected officials, to call senators, to email our representatives. Every one of us who walked a picket line or a strike line or filled out a concern for safe staffing form, that's why we are here. Our elected officials have heard us, our hospital systems have heard us. You took action, and the corporate healthcare system is moving. As nurses, one of our primary responsibilities is to advocate for our patients, and that doesn't end at the end of our shift. That work extends to the work that we're doing right now, and we will keep doing it until the Keeping Nurses at the Bedside Act is passed into law. Remember, we can do this together.